Okay, welcome back. Excuse you. Now we have to restart.
You're welcome.
We had one shot.
We didn't have one shot.
Now we have to just go right into it.
It's relevant.
Anyway, welcome back. We're going to talk about the COVID-19 stuff that's going on in the world right now. We thought we'd just touch a little bit on that topic and unveil our minds a little bit on what we think. So, to start off, we should probably just talk about what it is. It's a virus, obviously, and it's highly contagious virus. When it first was coming out, we were thinking that it was about as contagious as the flu. We now know that it's more contagious than the flu.
Mm-hmm.
The community spread is a big deal. It just stays in the air and on surfaces for a while, in the air for around 3 hours, and then on surfaces, depending on plastic or paper. That's how long is that? Do you remember?
Plastic is 3 days. Cardboard is 1 day, 24 hours.
Jeez.
Mm-hmm.
So it sticks around and it stays, and it's pretty good at infecting everybody and seeping into everywhere, and that's why you hear a lot about community spread and social distancing and why we're all staying in our homes right now in quarantine, and you see Italy and other places, China and all that
UK.
are UK, everywhere almost is, and now a couple of states in the United States are now in lockdown. And we were just talking about how Minnesota might be on that path soon because we're seeing some stuff come out.
Or the whole country as a whole.
The whole country.
Hard to say.
I don't know if the whole country will go. I don't. From what I've been watching personally on the news, just seems like that's not the president's mindset. But who knows?
Touching back up on that later, remind me. I have a side comment about that.
Yeah. Do you have anything else to touch? If you guys are really curious exactly on what this virus is, there are so many good videos out there.
CDC, WHO.
Absolutely. And then even here on this platform here, there's videos of plenty of people that are talking about what that is exactly and what you can do and how it spreads and that too. So we're just going to touch a little bit more, I guess, on the political side of aspects of things and how that's going to be looking versus just how you can protect yourselves. Because I think all of us know pretty much how it works and how you need to isolate yourself and how to protect other people. But we'll touch on that a little bit as well. Do you have anything else to add about the virus?
Just little side bits. I suppose delving into it more. I think I was definitely for the longest time, probably past when I should have been, still kind of holding on to it's just the flu. It's no big deal. Just wash your hands. Whatever, the statistics are the same. Get over it. Everybody's kind of freaking out. And then it probably passed the point when I should have realized it was something else, is then kind of when we started taking action, looking into it more. I think on top of it, just in terms of some of the things that were kind of coming up that I was ignorant about, is one of the main reasons why I thought it wasn't so bad was the death rate is really low. Similar to the flu, yada, yada, yada. It come and find out that actually makes it worse, having a lower death rate, because some of these other, previous potential pandemics, swine flu, Ebola, that sort of stuff that kind of was going around, it did have a higher death rate, and that actually helps stop it from spreading. Because if you catch something really fast, the symptoms show up right away, and then you're just dead all of a sudden, how are you going to pass that on? The virus, in order to spread and get into as many hosts as it wants to, thinking about it's sentient, but is that it doesn't want you to realize that you're sick right away, which is something part of this. It could take up to 2 weeks before you show symptoms. And there are, I think, 1 in 3 people who get it do not show symptoms, at least not severe ones, which is, another reason why it's spreading so much. And then on top of it is, because it has that lower death rate, it's able to spread to more people. And I think that's why we've seen the death rate or the number of deaths, I suppose the rate would stay the same, but the number of deaths go up because it has been able to spread more efficiently that way.
I'm touching on that too. It's now that, we're seeing more of the numbers come out, we're seeing that, it is also affecting obviously younger people. It's affecting even children. I mean, we haven't seen any deaths yet, but we have definitely seen that they experience symptoms differently, and they're still obviously they're the asymptomatic carriers out there as well that can still transmit the virus, and so you may not be affected physically by it, but you still are a carrier and are infecting millions, if not thousands, of people just by you coming into contact with them. And so that's a big way. So it's smart, it stays alive so it can continue to infect and grow.
Right. I think that's touching on the age thing. That was kind of another thing where I was like, it's affecting old people. Like, old people are more susceptible to diseases in general. But yeah, for the longest time, I think everybody thought that kids just weren't getting it because those symptoms were going missed. And like the testing is so rare and hard to come by, which I'll come back to that. But that they've said now, as young as 7 months old, a child has been confirmed as having it. And I could be wrong around here, but I believe it was like 17 or 18 youngest death.
And now they've even seen that it's been transmitted into domesticated pets. Like there was a woman in China whose dog got the virus and died. So, I mean, luckily the woman didn't die herself, but her dog did.
Right.
And so that's also a thing too that's happening. So it's like it's mutating already, and it's already super contagious. So that's why you see a huge panic on one side, because one side sees what this could be, and there's another side where it's like, well, it hasn't killed that many people yet. And so that's why you kind of see like, well, I don't know, I see like kind of like two sides to it almost.
Well, that's also, I mean, yeah, I've heard that and everything and see that, but I also feel like a big thing that is fueling that fire on that side of things is simply the fact that majority of governments are not addressing it in a very like hands-on kind of way. They're kind of stepping back and trying to keep cool, and part of that is like their role in this genuinely isn't necessarily to prevent the spread, it is to prevent panic,
Right.
which leads to that side of people who end up potentially spreading it more.
Right. So it's like, because I mean, if you have a big hand coming in and shutting everything down, that is going to cause a wide panic. Like, and I do see that's why, for example, the United States has gone so, I would say, slower
Definitely.
in terms of this, because they're trying to. I mean, Americans are crazy, honestly, and if you have everybody scared, there's going to be looting and violence and crime, and already our jails are getting overwhelmed. Already our hospitals are getting overwhelmed, and they couldn't have all that stuff start happening just on top of trying to treat this crazy virus that people are dying from.
Definitely.
So I can see why like it is slow, but also it's just like, if this is a big virus, I feel like there's options to be moving a little bit faster.
Well, I have seen some rumors, and just the way that things have been kind of phrased, it's one way to interpret it, from the president, from local governments, is kind of along the lines of, we'll give it 15 days where we will reduce some of what we can in terms of like traffic, that sort of thing. And once that 15 days is up, regardless of if it's better or needs more attention, we're kind of just going to push for business as usual, because ultimately those affected by it is less of an impact to society than shutting things down, especially from like a monetary point of view, which is very sad. I don't think that should be our goal, but it definitely feels like
they just want to get the economy back
the
on
kind
track.
of decision. Well, so the thing is, though, is like personally, maybe I don't know enough about economics, but I feel like if we would have just, I mean, again, this gets kind of difficult with like world economy, that sort of thing, but I feel like if we would have just kind of like as a country just shut everything down for 30 days and been like, no interest is getting earned, no interest is getting, charged, like all your payments, everything is skipped ahead 1 month. Like, we're basically just going to pretend like this month doesn't exist economically, and so on. And like everybody just gets a ration of whatever, toilet paper, food, water, ensuring that people have a safe place to go where they can self-quarantine. I think that would have done wonders for the economy and would have prevented so much of this, because to a certain extent, so many businesses are shut down now. So many people have been laid off. I mean, in theory, you would think you can just say, everybody, let's just snap right back up to normal. Everybody gets rehired at the same place. Everybody just kind of keeps doing their own thing. But, and I suppose if, like, as a society, as a world, if everybody chose to do that, I think we could get back on our feet very well. Because I think the whole issue here is it's a cyclical effect. It's a cycle. If everybody doesn't have jobs, they can't spend money. And if they're not spending money, more places are just going to shut down. More people are going to lose their jobs. And unfortunately, I don't think that there is going to be some miracle thing where everybody just kind of resumes everything like normal. I think a lot of companies have been using business as usual as kind of their key word, their key term lately. And I just don't feel like that's a realistic way to look at how things are going to be moving forward. I think a lot of people are cautionary when they're saying this might be a recession, we might be looking at things. I think it's past that point. Personally, I think economically how things are going, it's going to be a different economic world when we get out, regardless of how severe that looks like, that sort of thing. I don't know, but I do think it's going to be different, and I think trying to think that we will get back to something similar so quickly is unrealistic.
Yeah.
But I mean, I do have some numbers here. My mom went to John Hopkins University website. They have been keeping up to date with numbers, which, speaking of numbers in terms of like reported cases, that sort of thing, I think it's important to keep in mind that these cases are severely undercounted and unreported, partially because we don't have a even statewide or countrywide way of recording and getting everything all in one place at one time. But also because the testing just isn't available, and it's very, I don't want to say odd because it's expected, but it is kind of odd how there's so many rich and famous people that have, even if they think they maybe possibly walked down the same air that somebody else maybe breathed within the last 3 hours, that potentially could have talked to somebody's dog who might have had it, they can get that testing right away. And there are medical professionals, people who have been in direct contact, everyday people that have been unable to get the testing and have ended up dying, ended up having severe symptoms.
Mm-hmm.
And it just goes unreported. We don't know. I know there was an article recently where with Italy, things are so bad there that they pretty much said our hospitals are so overrun. There's literally, like, at this point, not much we can do. It's getting to the point where I don't think it's quite at that point yet, but they said it's getting real close to the point where if you get it, just stay home and pray you don't die, basically. Because there's nothing the government can do. There's nothing the hospitals can do. They don't have anything anymore, any room, any manpower, any more testing kits, ventilators, that sort of thing, which is quite sad. And they keep saying that the U.S. is about a week behind or less Italy. Um, so, keeping in mind with that numbers, going kind of back to what I said, my mom a week ago was on the Johns Hopkins University website, which they do have a running total of worldwide numbers. And as far as total confirmed cases, it was roughly 163,000 people have been confirmed with having the coronavirus. Total deaths, 6,000 roughly. And total recovered, estimated 76,000 people recovered. And then she did the exact same time. It was 5/12. She took screenshots, sent them to me. Same website, went back to Johns Hopkins a week later. This was on Sunday. And the total confirmed cases have now jumped up to 330,000. So, almost double confirmed cases. And total deaths have jumped up to 14,000 again, almost double, or more than double, actually. More than double. Over 2,000 people, more than double. Confirmed deaths, and total recovered went up to 98,000, which is a little more than 20,000 extra people, but not double. And that's also keep in mind that this is all a lot of people are unreported with those large spikes. And, it's kind of concerning, especially because I know a lot of companies are kind of following the government's procedures in terms of like trying to keep a cool on it and trying to save their businesses in the process, trying to not raise any alarms or panic. And kind of because of that, haven't been, I think.
It's just continues the spread.
Right. Because, I mean, we work at a financial institution, and going back to the whole, cardboard paper, the virus lives on there for 24 hours. And, it was something where it was like all the different financial institutions in our area were closing down the lobbies, et cetera, et cetera, but they're making exceptions to let people inside. They still had the drive through open, which it's like, how many, just on a regular basis, I see so many people lick their fingers, lick this, and touch things, and it's disgusting as it is, and super gross, and a lot of reason why people in.
Well, it's like, and regardless, it's like, even if you had, let's say you had one place closed down to drive through only, like McDonald's or wherever,
Mhm.
it's drive through only. You still
There's
have
so much
so much
exposure.
exposure through the air from that
Mhm.
short little distance, and also anything that they touch. Like at a financial
Mhm.
institution, you touch the pen, you touch the paper, you touch the drawer when you press it in. It's like there's so much stuff being exposed, and then also we know that these things last on these surfaces for multiple hours. So God forbid you don't get it with sanitizer all the way, it's going to stay there for a
Mhm.
while. And also, not to mention, it takes quite a few minutes, like 10 minutes, for that virus to die before it's fully dead with sanitizer. So
Right.
it's like you would fully have to sanitize that area before going back for it to be fully safe.
Mhm.
Before, otherwise, you're just going to ingest it because it's
And
still alive.
right, and a lot of these workers that we were not provided with any sort of masks or gloves, which I know part of that is the push towards like the hospitals need it. They are severely
Right.
running low. They really do need it more. But then it's also kind of
But if you're
like,
going to have things open still and run business as usual, you need to make sure to prevent community
mhm,
spread that you're
mhm.
protecting the people who are most at risk.
And it feels like one of those things where it's like if the government is not going to step up and close everything down like it should, which we talked about it, we understand why it's happening, regardless of how we feel about that. But as a community leader, as and somebody in this community, I think it goes along the lines of you have to look around as a business owner, as a CEO, and say, you know what,
In order to not
this
infect my whole community,
we're
I
gonna step back.
we're
We're
going to
not. We
shut down.
suggest you stay home. We're not gonna give you a reason to come out. And I understand that's kind of a lot of different businesses would have to make that decision together, but it just doesn't feel like enough in our community. Enough businesses in our community are stepping up and making that decision.
And it's because, we have the government saying follow your state guidelines, and but then what the states are doing is following the guidelines of like FEMA or the US
Mm-hmm.
government. So
Mm-hmm.
it's like we're literally all following the guidelines that are coming out of the White House. And so that's why things are moving so slow. You have,
Mm-hmm.
governors now like in California, and what was the other state?
Like Chicago, Illinois.
I don't know for sure, but I know for sure California, it's like it's
Mm-hmm.
shut down.
Mm-hmm.
They
Mm-hmm.
cannot go out and except for essential items like food or whatnot, just like in
Well,
Italy.
even then, it just seems very. I mean, I've seen. I think it was. It might have been Taiwan. Somewhere in Asia, they got hit really, really hard as well, being with close proximity to China, obviously. And their government, they actually handled it very well in terms of. I think it was just a single city that was quarantined. I could be wrong at this point, but um, they set it up where they were prepping like meal kits. They were giving people fresh hot meals. They were actually very considerate with it because there were some people from other countries that were being locked down there, unable to go back to their home country, and they're specifically creating meals that were traditional in their home country style rather than just Taiwanese food,
Hmm.
to ensure that they felt comfortable, ensure it was something that they'd be willing to eat, and everybody had full safety gear on, and they're just delivering these meals right to people's homes, free of charge.
That's nice.
Yeah, yeah, and it's like I understand that's again, a big economical impact, but I feel like it's one of those things where it's like, at the end of the day, money is a concept that we have agreed upon as society, and I feel like in times like these, we have the power as
To
a
push it
society
aside for a moment.
to let that go, to push it aside, to make ends meet. We have the resources. It's truly just a distribution of it and an understanding of what we're willing to do and not do. And I think that, worldwide, we could push that aside for
I mean,
now
honestly,
if we
don't you
wanted
think
to.
worldwide we've seen such a community come togetherness from
Mm-hmm.
all of
Mm-hmm.
this in individual communities and widespread? I feel like
Definitely.
it's
Common
definitely,
enemy
yeah,
unites.
it has definitely united
Mm-hmm.
us in a way that we haven't seen in a long time. I know
Mm-hmm.
definitely in a long time. So it's refreshing, and like, touching on that point, it's like if it's really just differences that are like keeping that from happening, and we takes a virus for us to all come together for a short moment, it's like we
Mm-hmm.
there's you could do a lot.
Well, it's funny too. I've seen a lot of people where they're saying, everyone's so against socialism, so against free handouts, so against this and that. Some people, and then it's been a lot of Republicans actually that have been pushing for this $1,000 paycheck to the people. Have been pushing for universal free health care for the time being, which is amazing. I definitely do not want to shame anybody or make them feel like you cannot change your opinion, or that your ideas of things are not dependent on the situation. No means in terms of like shaming or trying to push people away from opening their minds to other people's ideas, but it really kind of goes to show that sometimes these ideas that you're so scared of are are not as scary as they might seem to
They may be
be.
the things that you actually need
Hmm.
as a society. Because I
Right.
mean, think about it. It's like,
And I think that goes towards all parties, all social parties, is political parties, that
mm,
sometimes you need to open your eyes. I mean, obviously, like hate crimes, that sort of stuff, like don't open your mind to that. Which actually, I have been seeing some Nazi stuff lately regarding the
really,
coronavirus. Yeah,
jeez,
they have been intentionally trying to spread it to law enforcement and minority groups.
oh my god,
The FBI has been keeping an eye on that, trying to keep that under control.
jeez.
Yeah, but what were we saying? Yeah, no, just like going back to, opening your mind and realizing that, it sucks that a tough time has to bring us together, but I think it's kind of nice to be able to take this moment and be like, this does suck and things are not being handled correctly. But look at all these things that we thought were inconceivable that we could totally get done right now, that are
Right.
totally like we can all agree upon it and really just work together. And I find that beautiful.
It is beautiful. I mean, you see
Yeah.
American companies stepping up and making
Mm-hmm.
all these like medical equipment
Mm-hmm.
or other things, helping out
Mm-hmm.
with this crisis that they wouldn't normally do. And I think it's admirable, instead of the
Mm-hmm.
government having to step in and say, "Hey, you do this," to like the
Mm-hmm.
companies that are normally doing it. It's other companies too that are stepping up and saying, "Hey, we can do this too. We
Mm-hmm.
can help," and they put in the steps forward to make sure that that we're getting it done and staying safe.
Mm-hmm. Well, even social communities. There's schools are shut down right now, and those that were in medical school, obviously they can't just show up at the hospital and help out. They don't have the right certification or knowledge at this
Right.
time. But they formed a group of students here in Minnesota that were medical students, and they are offering pretty much any and every service you could think of for free for medical workers in the state of Minnesota. They need daycare, they need grocery pickup, they need literally anything just to make sure that these people can continue to work and do what's needed of them for
That's
our
good.
community. Yeah.
Yeah. I definitely see a lot of good things coming out of it for sure.
Mm-hmm.
But it's still, on that case, still like a scary thing that's happening,
Mm-hmm.
because it's like on the other side, it's like, when is this thing going to end? Because I mean, they say they hope that we have a vaccine by like summer.
Well, it also is
And
just kind of one of those things where I think the way it's been talked about is once you have it, you're immune to it, which is not the case with all diseases, by the way.
like the flu, it mutates and then you can get it again.
Right. So, but it kind of, the way that people have been talking about it, it sounds like once you get it, you're immune after that. And it kind of feels like it's going to be the point where we pretty much just have to wait till everybody gets it and see who's still here. Because especially if the government is not stepping up, it doesn't feel like they're going to. Kind of feels like after that 15 days, we're just gonna hop back into it. And I know, I mean, we work for a company that's very lenient. We're allowed to stay at home even though we are not considered working at home individuals. And after a certain point, yeah, we will not have sick time anymore. It's at some point we will have to go back, if regardless of how things are. Basically, I think the consensus here is if you have an influence in your community, step up. Tell people to go home, close what you can that you have control over. If you are able to stay home or work from home, please do. But we understand that is kind
Not
of
possible for
not,
everyone.
yeah, not possible for everyone, whether that's your work type or simply your savings and poverty level and where you're at with that, which is sad but true for right now. But do your best, do what you can, say, protect yourself, because even if you know that you're healthy enough, which you might not, there's plenty of people who are young and had no prior history of illness or anything that would suggest that they were within that realm that it would hit them hard. And it's kind of hit or miss whether you're one of the three
There's
people
young
that
people with ear like just permanently damaged
yeah.
lungs now, and
Mm-hmm.
so just be safe,
Mm-hmm.
be cautious of who else you could potentially be coming into
Exactly.
contact with, because it's not just you, it's so many other people
Right.
that, I mean, there's obviously good videos out there. Like, I would suggest watching the Mark Rober video. It does a great job at showing you how exactly germs spread and
Mm-hmm.
how easily it spreads, and
Mm-hmm.
how what the steps you have to take in order to make sure that you get the germs off of you. And
Right.
so just make sure you're prepared. Do a little bit of research, especially if you do have a little bit of time being in a quarantine or
Mm-hmm.
isolated a little bit more from normal. I would say just definitely try to keep yourself as informed as possible. Not
Mm-hmm.
enough to make your anxiety go crazy, but definitely stay informed with
Informed, yeah.
everything. And just God bless you all, and I hope you all stay safe and
Mm-hmm.
have a wonderful day. Thank you all for watching. If you liked what we talked about, obviously there's so much that we could still expand on, especially currently, and we'll definitely be thinking about making updates to this video if we find it necessary. But if you like
Mm-hmm.
this video, give it a like, give it a comment. Comment down below if you want us to make another video like this as well. Thanks for your support, and subscribe. Bye.
Thanks. Bye.